Hi, my name is Dr. Emily, functional podiatrist and human movement specialist. I want to speak to you today about releasing your feet to reduce neuroma pain. Now, a neuroma is a ball of scarred nerve tissue that is found in the front of the foot in between the long bones that are called metatarsals. Now, what's also found in between the metatarsals are a bunch of small muscles, soft tissue, and fascia. Any sort of stickiness or tightness in the tissue or muscles can actually cause compression on the neuroma. So I want to take you through a 5-minute foot release that I recommend to my patients to reduce the neuroma symptoms. For this, we're going to use the Neuro Ball by Naboso. So when you take the Neuro Ball, I want you to take the seam and you're going to place it on the ground face up with the seam. Put your heel on the ball and you're going to push straight down to open up the ball. You'll place your thumbs in the ball and then split it open, and inside you'll see a small rad micro. For now, we're going to take that and put that to the side. You're going to take the two domes and you'll place them onto the floor. Now, the part of the foot that is associated with the neuroma is going to run from the heel all the way to the ball of the foot. So there's 3 main areas that I want you to focus on. We're going to start by placing the foot all the way back by the heel onto the dome. This is where you want to start. We would hold our foot here for approximately 30 seconds, and you can do both feet at the exact same time if you would like. After 30 seconds here, we're going to go back into the middle of our arch. If you want to increase the amount of pressure, you can just lean your body forward or shift your body weight to one foot or the other foot. After 30 seconds here, we're going to go forward to the front of the foot. Now be careful because this is where we find neuromas. But what we're trying to reinforce here is opening up metatarsal splay. We're holding our body weight here. Again, if you want to lean a little bit more to the left foot or to the right foot, if you want to go a little bit more towards the inside of the ball of the foot or the outside of the ball of the foot, you absolutely can. Now, after you do that release, I want you to grab the rad micro. We're going to now place that on the floor, and we're going to repeat those same areas. Now for this, it's a smaller surface area, so again, please be careful. I'm going to start by placing my heel onto the rad micro, just 1 foot at a time. I'm going to hold there for 30 seconds, and then I will repeat to the middle of the arch. After 30 seconds here, this is where it's a little bit different. You can now roll forward to the metatarsal heads, but again, this is where you find the neuroma, so please be careful. You never want to go directly on the neuroma. We are going around the neuroma. So I'm going to work under all of the metatarsal heads. We have 5 met heads that we're working under. The one that is centered around your neuroma pain, you might even want to skip it and go past that towards the other metatarsal. And then as you continue to do this release and your symptoms decrease, you can start to introduce the rad micro closer to where your neuroma is. We are, of course, doing this on both feet. Even if they are asymptomatic, we want to make sure that we keep both of our feet mobile and strong. I recommend doing this release every single day, at least twice a day, especially if you have active neuroma symptoms. If you're looking to learn more about the Naboso Neuro Ball and how to reduce your neuroma symptoms, then please visit dremilysplickle.com.